The Department of Health has noted media reports in which various stakeholders have made public comments regarding the National Health Insurance Bill. The department has encouraged all interested parties that have constructive comments on the National Health Insurance Bill to engage with the consultation process that Parliament has rolled out in provinces. The review and amendments to the bill will now be managed by Parliament. For more on this, I'm joined in studio by the Department of Health Director General, Dr. Anban Pillay. In fact, Dr. Anban Pillay is the Acting Director General at the National Department of Health. Thank you so much for your time this afternoon. Of course, this opportunity or this time has given the public an opportunity to comment and engage with the National Insurance Bill. Take us through how that process has been thus far.
So the Parliamentary Portfolio Committee in the National Assembly published the bill and invited all interested parties to provide comment. And that process closed on the 30th of November, where written comment was received. The Portfolio Committee is also going through provinces, holding hearings in various towns within provinces, usually 2 or 3 districts within a province, where they're receiving comments relating to the bill, where an ordinary man in the street can go into those hearings and share their views.
And those are particularly very important,
yes,
especially in rural areas,
yes,
because you literally have to take people through what it would mean
for them. Yes.
Yeah. How has that been going?
So that's been going fairly well. I think the public are getting an understanding of the NHI firstly, and then in many cases people are asking questions about various aspects about the bill and sharing their views. So the Portfolio Committee will take notes relating to what the public views are, and then they will have a debate at the end of that about what comments they would want to incorporate into the bill and how they do that, etc. That process is then repeated by the National Council of Provinces as well.
Okay.
And so it's a very lengthy consultation process.
There have been plenty of concerns, particularly coming from doctors who said that they would even consider leaving if the NHI is fully implemented. How are you dealing with such, apprehensions?
I think it's only natural when you have such a significant and radical change to the current structure of the health system, both in the public and the private systems, that people fear change and are concerned about the uncertainty, that people may react by saying that I'm going to be leaving the country. But I think if they think about what it is that they'll be going to and think about the system that the NHI is going to introduce here, they would understand that the system is not as bad as what it may appear to be. Very many people who are participating in the NHI process are usually involved in the process without understanding what's written in the bill, but reading somebody else's interpretation of it. And so I really urge everybody to go through the bill and understand what's actually in the legislation.
Do you think that's what's been behind and has been fueling most of the fear about the proposed changes?
Yeah, look,
people aren't really reading and engaging with the bill itself or the proposed bill.
Yeah, so I've been talking to health professional groups across the country, and in many cases people ask questions, and when they ask a question, I usually ask, how many of you have actually read the bill? And it's very clear that a handful of people have. And so the questions are related to what somebody else had told them about what's going to happen, which is actually untrue. And so they've gone along with that rather than just understanding what's in the bill. But usually when we have these meetings, we're able to clarify that. And I think the leadership of many of the doctor groups, for example, play an important role in sending out these messages. And I think working with them, we hope that we'll be able to reach every practitioner to understand exactly what the NHI is about.
This is certainly coming at a time where there is just deep uncertainty and some say mistrust in the government. So not many people actually feel that government would be able to deal with the project itself. Many asking themselves if government is even competent to deal with what would come with fully implementing the bill.
Yes, I think that those questions will be asked, and I think at the end of that, one needs to ask the question: what would be the alternative to the current system of health that we have in the country, looking at the best practice globally about how do you provide access to your citizens in a manner that's accessible and affordable. And global best practice suggests that you move to a universal health coverage system, and the NHI for South Africa is a better solution than where we are currently. There will always be problems with any government and its implementation, but we need to appreciate what those problems are and implement measures to deal with those risks. So
some are even saying, I mean, this is tantamount to just the nationalization of the private sector. So essentially it's like compelling doctors to work for the state.
So doctors are free to not work for they're not forced to work for the NHI. They may choose to do that. It will be an economic decision that they would make as to whether they want to contract into the NHI or not.
Okay.
But it would make sense for doctors to actually participate in the NHI, because currently if you talk to many doctor groups, they will tell you they have serious problems with the way they are reimbursed by medical schemes. Certain services are covered, some are not. They have problems of coding, etc. And so under the NHI, they will be paid by a capitation system, which is
Take us through that system and how it would be beneficial for the doctors.
So basically under capitation, within a population, you would have a GP that is offering a service.
Okay.
And people would register with their GP and say, when I get sick, I'd like to come to you. The NHI fund will then contract that GP, taking account of the population that's going to visit him or her, and reimburse him on a monthly basis for delivering services to that community. So the doctor will be assured of a consistent payment every month, and not having to worry about sending in codes and which services are going to be paid for, etc. Basically, it'll be an all-encompassing fee that takes account of all of the services that he or she would potentially provide. We would obviously work with the GP groups to make sure that those services are in line with what GPs can provide, and the reimbursement must obviously be reasonable to cover their costs and give them a reasonable income as well.
So that's how it will affect health workers in the sector. Let's talk now how it would be possibly beneficial to just normal patients and South Africans.
So I think from an ordinary man in the street perspective, you'd have firstly those that are currently accessing care in the public sector. This would allow them, rather than having to go to a clinic first and access care from a nurse and then having to be referred to hospital, they would be able to access care from somebody in their community that previously they may not have been able to access simply because they couldn't afford the cost of that care. On those that are on medical schemes, you have a medical scheme benefit package, and usually that would limit the number of GP visits that you have or the amount of medicines that you can access. Under the NHI, there are no such limits that are defined, simply because when you get sick in a particular year, you do not decide to get sick within the limit. It's not as if you want to overuse your services that you usually go to visit a doctor. So the NHI system is based on clinical need rather than on limits as what an insurance model is based.
All right. So what now going forward insofar as the consultation process is concerned?
So the portfolio committee will continue with their consultation. There are 4 more provinces that consultations must continue in: Gauteng, the Western Cape, the Northern Cape as well. Consultation must continue in, and when those, they will then also what clauses within the bill need to be amended based on the views of the public. That process is then replicated in the National Council of Provinces. So there's much opportunity for those that may be concerned or have ideas about how things must be amended to share those views with Parliament so that they can amend the bill where they think it's appropriate.
All right, let's leave it there. That was Dr. Anban Pillay, who is the Acting Director General at the National Department of Health, just updating us there on the consultation process that has been happening regarding the National Health Insurance Bill.